Hypothyroidism is a condition in which the thyroid gland is either not making enough thyroid hormone, the peripheral tissues like the liver or the kidneys are not converting the hormone into the more active form, or the receptor sites are very sluggish and are not accepting the hormone. It leaves the patient with a variety of symptoms such as fatigue, inability to lose weight, weight gain, dry skin, brittle nails, loss of hair, constipation, depression. The list goes on, and that's why I put the list in my book for people to review. There is a much greater population of hypothyroid patients than has been estimated. It has been estimated that 10% of the population is afflicted by hypothyroidism, when in fact it's about 60%. It's an epidemic. Well, it's an epidemic simply because it affects the majority of our population. It's much more widespread than commonly thought. The reason why it's more commonly present than has been projected is the fact that we test for it wrong. We use the wrong laboratory studies and don't use the physiological data that is available to us, and we certainly don't look at the patient. When I say we, I'm talking of doctors. There's a course in medical school called physical diagnosis, and it's part of your basic schooling before you get into the clinical rotations. Many physicians forget about what's taught in physical diagnosis and rely upon laboratory studies, x-ray tests, other tests, and forget about the skills of being a physician. Well, when hypothyroidism is diagnosed, unfortunately doctors have not been taught to replace and supplement with thyroid properly. Instead, they use a product that's synthetic T4, and they use that simply because the drug company that manufactured that particular drug, Synthroid, put on a massive advertising campaign back in the 70s and 80s and persuaded doctors that it was the best choice. It really is not. Part of their marketing campaign was to disparage and talk badly about Armour thyroid, or desiccated thyroid. Armour is a brand name, when in fact that's probably the best preparation around for treating hypothyroidism. Well, synthetic T4 is the exact same molecule that the body makes, and the thyroid does make T4 molecule, or T4 hormone. However, the most important hormone is T3, by far, by a factor of 4 to 5. And if the body is not converting enough T4 to T3, then the patient is still hypothyroid, but the tests that doctors have been taught to use don't reflect the fact that we don't have enough T3 in our body, so the patient remains hypothyroid. The patient still feels bad, but the labs look good, so the doctors practice laboratory medicine and not patient medicine, and that's a big mistake. And again, that's why I wrote the book. Type 2 hypothyroidism is a resistance to the thyroid hormone at the receptor site. It's everyone's heard of type 2 diabetes. That's a receptor site problem. The patient has enough insulin, but the receptor sites don't respond properly, so the patient is diabetic. Of course, we're not talking about diabetes, we're talking about hypothyroidism. In that case, the receptor site in all the cells, the receptor sites are very sluggish and don't accept the hormone like they should, and as a result, the patient's hypothyroid. Unfortunately, there's not a test to determine that, and it's up to the doctor to be skillful enough to recognize the fact that higher levels of thyroid supplementation are absolutely necessary to get that patient back into normal functioning.